हमारे साथ इस यूनिवर्सिटी के स्टूडेंट्स हैं डॉक्टर इकरा। उनसे हम बात करेंगे और पूछेंगे कि इस यूनिवर्सिटी के जो हॉस्पिटल है, हॉस्पिटल का कैंपस कैसा है, डिटेल्स इंफॉर्मेशन इनसे पूछेंगे। सो हेलो डॉक्टर इकरा, नाइस टू मीट यू।
Hello,
कैन यू
sir.
एक्सप्लेन टू आवर ऑडियंस अबाउट योर हॉस्पिटल?
Yes, sure, sir. Thank you so much, sir, first of all, for joining us here in IUK Amanat Hospital. So I would like to introduce myself to the audience. My name is Dr. Ikra, and I'm a first year, a postgraduate student in International University of Kyrgyzstan. And currently, we are present in Amanat Hospital of IUK, where the simulation center of IUK is also attached, where our students are doing their practice and they are learning the new clinical skills. So I would like to tell you, sir, that IUK basically recognized from more than 10 government hospital of Kyrgyzstan, and we have our own two hospitals, Amanat Hospital and Vedanta Hospital. So we are in one of the hospitals of IUK currently. So I'll take you on a tour to our Amanat Hospital
Thank
and
you so much.
Simulation
Please.
Center.
Hello everyone, my name is Dr. Mohammed Umar, and currently I am standing over here in one of the lecture halls of our own university hospital, lecture halls, and it is attached with our university hospital, which we will be showing you, and all our state-of-the-art facilities that we provide over here that I use personally to become a better doctor for a better future. Over here we have mannequins that are used to teach students how to do small invasive you can say procedures. For example, this we have a simulated arm over here, and you can see that it feels like real. It is rubbery, just like our skin over here, and we teach patients, we teach students how to palpate the veins, how to palpate and how to go inside. Over here you can see that we have cannula, we have the catheters, and we have the red color over here in order to show the students that when it will pass through the veins, how it would look like. And over here is also one of the mannequins. You can see over here that a mimicry has been done, same like blood, so that when they will go inside, okay, when they will produce the needle inside, they can see that either they have punctured the vein or either they are inside normally, or what is happening. So that's why some different coloring has been used in order to display these things. Okay, sir. So over here we have this digitalized board, and students practice over here lung and heart auscultations. As we have many different type of sounds in lungs, we have crepitations, wheezing, all that, and we have different valves. So by using this board, using this stick, the teachers they teach. For example, they will select different modes over here, and different voices will come from this one. Similarly, we have this mannequin over here. By look it looks similar, but it has installed program already in the software. So if we click one of these, as you can see on the monitor, that these are all the auscultatory points of the heart, right? So the light will blink, and behind it the speaker will give you the voice of what sort of it feels like, so a student can get more a reality based idea of the heartbeats. So over here you can see that I am using this plastic suturing pad, which technically feels real. So over here we cannot shift students directly on the patients while to learn suturing. So we provide such sort of mannequins, such sort of pads for the students, so that they can practice their suturing and get their skills as better as they can. We train the senior students who are studying surgery, how to do laparoscopic surgery, what are the protocols. This TV, it has guidelines, the protocols, and this area you can see the mannequin over there. It is all sterile field, how the doctor stands, how to approach the patient while having surgery, what to do, how not to do. All the instruments are placed over here. It's a mimicry of an OT. Okay, so this is the representation of you can say a fetus, how it's inside the womb. Okay, so we have some things which we call the position, either the baby is in normal or not. So that's how it is, because the baby is mostly on the right side. That helps in the fetal sound and fetal heartbeats and everything. So this is how a baby is inside the womb, on the right side, and like this mannequin lady, a pregnant one, and this is a visual representation of how babies are inside the womb. Okay, so this is actually the placenta, and this is the umbilical cord, which is attached by the mother and the baby. We have many different positions. We have breech position. Sometimes the baby is like this, sometimes the baby is like this, sometimes the baby gets like this. So all maneuvers are shown over here, and sometimes this umbilical cord is strangulated around the neck of the baby. So that presentation is also shown over here, that how do we have to undo it, and how do we have to save the life of the baby and the mother. Okay, sir, we have this ambulance over here. It's a simulated one. It is placed over here so that we can show our students how to deal with the emergency situations. For example, we have a collapsed mannequin over here, and we have attached this motor over here, and this is to practice CPR, resuscitation, because when a patient collapses, it's very much necessary. So in order to do the perfect one, if you will do it correctly, the white light will blink and it will show that we are doing the correct one. If we are not doing it correctly, if the hand position is wrong, it will blink this one, and if we are doing the auscultation wrong, it will blink this one. So if we are doing the correct one, the white light will blink. So that's how we know if the student is performing accurately or not. In therapy department, you can say it's kind of internal disease, cardiology, rheumatology, all those sort of things are dealt over here. So it has two sections. This is the VIP zones for the patients who want proper VIP treatment and VIP rooms, and we have normal regular rooms for the regular patients over here. So this is the start of so everything over here is on this section. This is on the offices. So this is you can see a ward for the patients. And it's but over here you can see the doors are closed and we have all operation theaters over here. Okay. Plus, so we have patients. This is the reception. And you can see over here the doors, post-operative and properly furnished, high-tech. They have everything. Rehabilitation and also pre-op. So when we are preparing the patients for surgery, we bring them over here, and after the surgery, we take over here before shifting them to the wards. And after that red light is the 100% operation theater zone, so we cannot enter over here, and we have to be properly equipped with all the surgical masks and everything needed for it. Aftab Hospital, polyclinic, or in our language we say this is the OPD. This is the laboratory, all the sampling, blood tests, everything we take it over here. And then this is the OPD department. They have pictures of all the staff that has been working here in all of the departments. Apart from that, you can see that this is the OPD. We have all departments over here and doctors take the patients. If they are required to get admitted, then they are admitted in the floors which we just visited. So we have all of them. We have the nursing station, we have the radiology department. This is traumatology. Then this is the urology. Okay. This is the X-ray.
X-ray.
Yes, X-ray. Okay, so one of the best labs over here in Kyrgyzstan, it is Aqua Lab, so they are also in collaboration with them. So they send their delicate or complicated blood samples or other samples to those labs. Then we have this area. Over here we have endocrinologist. Okay, this is their room. This is the Lord is named ENT. So this is the office of the ENT. You can see that ENT specialized chairs and everything is placed over here. And we have doctors. Gastroscopy or colonoscopy. Yes, we can see from over here. We have this all equipment for gastroscopy and colonoscopy. A separate entrance from outside. So this is the pediatric OPD. They have themed it like that so that if small kids will come, they will not feel scared. Okay, all the stickers, everything, doctor's name, the walls, it's painted in that favor so that the pediatric patients, because those small little engines, so they don't feel scared regarding that. This is the main reception, and as we have taken them towards the first floor of polyclinic, second is surgery, third is therapy, cardiology, fourth is pediatrics, neurology, and rehabilitation. So this is the main reception. We have receptionists present over here, which can speak English also. And cafeteria is here, so the families who are coming over here waiting for their family members, they can sit over here and enjoy the ambience. And this is all about